So I want to thank everybody for submitting some questions. So happy birthday to the first log on person there. Call you back a little bit. So tonight, I'm going to be talking about the questions that were submitted over the weekend. So hope everybody had a good weekend, and those in St. Louis, hope you survived the storm. Had no internet for about 48 hours other than on the phone, which isn't so bad. Try to go a little bit less screen heavy over the weekends. So, but the internet's back on. I'm going to be doing this live tonight and answering questions about heart health. So have many questions to go through tonight. Thank you again for submitting them. So somebody submitted a question asking about some natural ways to lower blood pressure. So last week I did a talk about how to actually accurately measure your blood pressure. But blood pressure ideally should be less than 120/80. Top number systolic, bottom number diastolic. So the number one natural way would be to be outside in the sunlight. UVA radiation from the sun will vasodilate your arteries by releasing nitric oxide. Your blood pressure comes down. The sun is a natural calcium channel blocker. Exercise is going to help. Stress management, so meditation, something we'll talk about later, HeartMath, where you have coherence with deep breathing exercises can have an effect with blood pressure. And I think I already mentioned exercise. Those are the main ways. So I don't really get into talking about supplements, for all. It's going to be based off your individual context. And if you want me to kind of talk about supplements for blood pressure, it's probably best to do it at an office visit at Apollo Cardiology, my main office in St. Louis, Missouri. So somebody had a question about their mother having an arrhythmia post-COVID infection and is on an antiarrhythmic called flecainide or is interested in some natural alternatives. This is, again, something I can't provide medical advice via this form, so I can't give you specific alternatives to flecainide. Flecainide is an antiarrhythmic medication. Best talk to the doctor who put you on the medicine because there's a way that you have to come off of it if you're going to go on something other than that. But COVID, one of the major things it does is it damages the endothelium, the inner lining of your arteries. But if you damage the endothelium, those linings don't release nitric oxide as well, and it tends to cause blood clotting, tends to cause blood pressure issues, and I've seen a few patients post-COVID with palpitations and heart rhythm issues. So not uncommon to have rhythm issues after COVID. If you have it, you generally need an EKG, potentially a Holter monitor or a vent monitor to catch what your heart rhythm is at that time. And then they can figure out what to do based off of what that rhythm is. Somebody had a question about how fast can your lipid panel change after changing your diet? Actually pretty quick, just a couple of days will make a difference. But the better question is how long can you keep it down with a diet change? Probably not that long. If you change your diet back, it'll just go back to your natural set point. There's a gene, apolipoprotein E or ApoE, ApoE. You get one copy from your mom, one from your dad. There's either a 2, a 3, or a 4. The most common one is a 3/3. Those people tend to make cholesterol normally, recycle it normally. The 2s tend to have lower levels of cholesterol. The 4s tend to have higher levels of cholesterol containing particles. I'm a little bit basic, so when I use the word cholesterol, I'm usually talking about the lipoproteins that transport the cholesterol around the system. I've done previous videos, Lipid 101, Lipid 102. Just go back on my Instagram TV if you want to see the in-depth lipid talks. But your lipids will routinely go back to your natural set point after you change your diet up a little bit. So nutrition rarely will keep your levels at a steady state. Your diet intake of cholesterol has very little effect on what your lipids are. It's more your sugar intake has an effect on that. Yes, particles matter, but it's going to matter, are they oxidizing? Do you have inflammation? And are those particles actually getting retained in the walls of the artery? So that's where you want to know, do you need to do something other than lifestyle changes to adjust your lipids? Somebody had a question about low blood pressure. I don't know for sure if the question was, is their heart healthy if they have low blood pressure? What is low blood pressure? Potentially the systolic blood pressure under 90 would be considered low, but really it's all about, do you have symptoms? So are you lightheaded when you stand up? Are you dizzy? Are you nearly passing out or actually passing out? Then that's symptomatic hypotension or low blood pressure. That's a problem. Potentially it's venous pooling, blood pooling down in your legs, or you have a autonomic nervous system issue where the arteries and the veins don't constrict when you stand up. You can see your cardiologist and they'll kind of help figure out why your blood pressure is on the low side. It could be something with your adrenals, your stress hormones. But if your blood pressure is running low and you're not symptomatic, my natural blood pressure is generally in the upper 90s to low 100s. I'm not dizzy, so I'm not concerned about the quote low blood pressure. Somebody had a question, are PVCs normal? PVC stands for premature ventricular contraction. So the heart has 4 chambers. It has 2 upper chambers called the atria, 2 lower chambers called the ventricles. The premature ventricular contractions come from the bottom chamber. So normally the top chamber squeezes, the bottom chamber squeezes. What happens with the premature ventricular contraction is the bottom chamber squeezes first. The top chamber has to reset, and then when it resets, heart fills up with more blood than normal, and that squeeze makes you feel kind of a thump, or feels like your heart's skipping, or you have a heartbeat. Majority of the time, premature ventricular contractions are benign, or not going to cause you any major problems. They can be bothersome, but generally can be a marker that something else is going on. Maybe your thyroid's overactive, maybe your electrolytes, your potassium, magnesium levels are out of balance. If not uncommonly, where do you keep your cell phone? If you're keeping it in your sports bra or your chest pocket or on your body, you're more likely to have premature ventricular contractions the closer you are to electromagnetic emitting devices. So it typically is look at your environment, and then look at your biochemistry, the blood panels, and figure out what's driving it. Sometimes you need a echocardiogram or ultrasound to look to make sure that the ventricle is normal. If you have a structurally normal heart and you're not passing out, typically you can find the cause of the PVCs, and they will be benign. Other times there are some supplements and medications that can kind of cool down the premature contractions. Again, sometimes it's due to stress or cortisol, so figure out what's going on in the environment, lower the stress, the cortisol, the premature ventricular contractions cool down. Somebody had a question about calcification effects. I anticipate it means calcification of the arteries, but there is times where the heart valves will calcify, mainly the aortic valve, the valve that lets the blood flow out of the heart. More common in people who have lipoprotein a or LP a. That's a genetically inherited lipoprotein. 20% of the population has that. It's not done on your traditional lipid panel, but if you have elevated LP you're at higher risk of atherosclerosis or plaque forming in your arteries. But you're also at higher risk of atherosclerosis, which is a calcification of your coronary arteries, as well as your aortic valve. So if you have LPLA, you need to talk to your doctor about what are some potential options to lower inflammation, lower LDL particle count or your ApoB count, and then you may need an echocardiogram to look at your aortic valve, especially if the doctor puts a stethoscope on your chest and hears a murmur, which is just turbulent blood flow going across that aortic valve. But if your question is, what can cause calcification of the arteries, typically it's going to be inflammation. So the arteries get scratched up with inflammation. Plaque starts forming, your body's trying to repair that plaque. At the end process of the plaque, the arteries calcify. So, the other thing that could potentially cause coronary artery calcifications is electromagnetic frequencies. EMFs can have it happen. So EMFs will cause calcium efflux or leaving of the cell, and then the cells will calcify. So it's somewhat thought that the CT coronary calcium score test can be somewhat of a screening test for how much 5G or the electromagnetic frequencies are affecting your body. Sometimes people have a parathyroid issue that has a regulation on their calcium metabolism, or if they have renal failure, has an effect on how they're processing calcium. But vitamin K2 and vitamin D are very important also to keep calcium where it's supposed to be. Somebody had asked a question about what is the best cardiovascular exercise. Really depends on what your goals are with that. Typically, if it's for more longevity purposes, you're going to focus more on the zone 2 type training, low and slow, where you're not getting into the anaerobic phases of exercise. So it's an exercise that you can do pretty much all day long. You could hold a conversation, be about a 5 out of 10 of intensity. If you have a heart rate strap, generally about 60 to 70% of your maximal heart rate. That's generally the kind of goal heart rate you'd want to have for cardiovascular health. What that does is it helps with mitochondrial biogenesis, so you make more mitochondria, so you make more little engines that can burn your sugar and fats for you. So it's probably the best cardiovascular exercise. The metric that you can look at if you have a well-conditioned cardiovascular system is something called VO2 max. That can be done with a device, either a bicycle or a treadmill. Actually, at Apollo Cardiology, I'll be upgrading my space in about a month or two and looking at getting an exercise bike where I'll be able to do the VO2 max testing. So that'll tell you how condition your cardiovascular system is, but it's also a good biohack to tell you how healthy your mitochondria are. So the higher your VO2 max, the healthier mitochondria. But if you're somebody who's generally more fit already, and you want to do more interval training, then it depends on what your VO2 max is. That determines like how long your intervals actually are. If you're super fit, Olympic athlete, you're going to do 10 minutes or 20 minutes of interval training. If you've never done interval training, maybe you can do like 5 minutes of it. But first look at more of the zone 2 type training. I've done a previous Instagram TV on it. It's also up on my YouTube channel. There's also an extremely excellent podcast by Dr. Peter Attia, interviewing a gentleman, I can't remember his name off the top of my head, but if you just search Peter Attia, The Drive, Zone 2, he did like a 3-hour podcast with this guy talking about how to do cardiovascular exercise on a bike for the most part. Somebody had a question about the connection between the brain and the heart. So that would be more what I would look at is the vagal nerve and how do you stimulate the vagal nerve. So you have something called the autonomic nervous system. You have a sympathetic side, you have a parasympathetic side. The sympathetic side is your fight or flight response. The parasympathetic side, your rest and relaxation response, mainly stimulated by the vagal nerve. The vagal nerve starts up in the brain, goes down through your heart into your gut. So you can, with different deep breathing exercises, so meditation can do it, but if you want biofeedback, there's an app called HeartMath. There's a device that clips to your ear. It's measuring your heart rhythm, and you measure heart rate variability. So as you breathe in, the heart rate expands. As you breathe out, the heart rate contracts. The better your heart rate variability, the better your cardiovascular condition you are, but also the less stress your body's under. And over time, you can get cardiac coherence, basically, so the heart and the brain are talking better. So if you get that under control, generally your sleep improves, and if you have blood pressure issues, your blood pressure tends to improve. All right, somebody had a good question, and I've heard it before, but I can tell you I'm not the expert on it. But somebody said, is the heart a pump or is it a magnet? People typically think the heart is like a piston pump, and it's just squeezing the blood and going through your 60,000 miles of blood vessels. But the heart's pressure differential would not be strong enough to actually push blood through 60,000 miles of blood vessels. So the heart has to do it in a different way, and I don't think they fully elucidate exactly how they do it. But the heart does do a couple things other than just pump blood. It does have torsion, so the heart actually kind of rings like you take a towel and you squeeze it. The muscle is actually, rotating. On an echocardiogram, if you do a speckle tracking, you can actually see that torsion. You can measure something called strain, so you can see the speckles moving up and down. You can measure that distance, and then you can look at torsion as well. So if your heart isn't, ringing very well, you have a weaker heart, probably an energetic issue, so a mitochondrial disorder. So figure out ways to improve energy function to your heart. So typically start with sunlight or photoball modulation, and then there's different supplements, nutrients, and potentially medications that can help with the mitochondrial function. But the heart also has electromagnetic fields. So you probably have wondered, what is an EKG? How does it actually happen? So when they put the little stickers all over your chest, they're measuring the electrical activity that the heart is putting off. What's creating that electrical activity? That's the mitochondria in the heart. Now your heart by weight is about 1/3 mitochondria. But whenever there's an electrical field, there's also going to be a magnetic field. So the heart is electromagnetic. Now there is some idea that potentially the way the blood is flowing through the heart, it's going through a magnet and it's getting accelerated with that process. There is something called a squid device. I was looking this up before jumping up at Here Live. There is one at MIT. See most of the other type of devices to be able to measure this magnetic field off the heart. Typically are in Germany or Hong Kong. I don't see any clinical facing ones in the US that I can see easily be obtained. But the magnetic fields coming off your body have been reported to go out at least 22 feet, so it interacts with other things in your environment. So there's maybe one of the reasons why too, your cell phone, your Wi-Fi, someone acts, not exactly, but acts kind of like a radar jammer as the heart is trying to sense the environment. You jam that magnetic frequency with Wi-Fi, 5G, something like that, you have more palpitations or issues. So, but great question. I'll have to keep doing some deep research on that one. And then I think the last pre-submitted question, then I'll open up to any live questions. Somebody had a question about congenital heart disease and maternal diet during pregnancy. So I'll give this a caveat that I'm not a pediatric cardiologist. I'm an adult cardiologist focusing on heart attack and stroke prevention. When I was doing my cardiovascular training, which is 3 years in duration, did have an interest in congenital heart disease and did do some rotations, but this topic never really potentially came up when I was doing that training. So I had to do a little bit of research today. Of the articles I could see, many of them were overseas, some were in China. There's definitely some general idea that you should optimize your folate, your B12, your B2, your niacin, but which congenital heart disease that this person's child has, they did not necessarily comment on, so I can't tell you if they had a cyanotic or acyanotic heart disease, or if it was a like atrial septal defect, which are extremely common, or a ventricular septal defect. Typically the tetrahydrogen flow, the cyanotic defects were less in people who had optimal nutrition. So that kind of goes down a little bit of a rabbit hole. Yes, the time to get ready to have a baby is way before conception. So ideally, now this was for optimal. I'm not telling you this is what you should do, but kids conceived in the summertime tend to do better because the high UV light on the body of the mom will tend to have a better egg get emitted from her ovaries. The ovaries are the location with the highest amount of mitochondria. So if you're a younger mother, you're going to have healthier mitochondria in that egg. If you're a mother who's 40 years old putting out that egg, those mitochondria have been there for 40 years. They've had a good chance to develop a lot of heteroplasmy or mutations in the mitochondrial DNA. So nutrition, yes, is important, but it depends on how old you are when you're getting pregnant. Depends on what your EMF, your light environment is when getting pregnant. You definitely want to have high levels of DHA, which is found in seafood. The DHA is extremely important for brain health and development. The heart, like I said before, by weight is 1/3 mitochondria. You put most of your mitochondria in your heart and brain, so anything that can feed those things is going to help them most likely develop appropriately. So if this person who asked this question is more interested in a deeper dive with this, just send me a direct message, and potentially we can set up a telemedicine visit, and that can really dive deep into your story and what your daughter actually had surgery on. So that's my live questions. I'm sorry, those are all my pre-recorded questions. So let me see if there's any other questions people are typing in. So somebody typed in a question: if you've ever had a calcium score test done, should it ever be repeated? So this is a great question. It's a little bit nuanced. So a CT coronary calcium score test is an excellent non-invasive way to tell you what your risk of having a heart attack is. Calcium is supposed to be in your bones and teeth. It's not supposed to be building up in your blood vessels. The CT coronary calcium score test is a low-dose radiation scan that looks for calcifications in the walls of the artery. Ideally, your calcium score should be 0. So if your score is 0, your risk of having a heart attack over the next 5 years is reported at 0.4%, so very low. So if you have a CT coronary calcium score of 0, you likely should repeat it in 3 to 5 years. Make sure it still stays 0. If you have other risk factors, you have Lp(a), you have strong criminal history, maybe you're going to be on that shorter end of rechecking it. Now, if you're somebody who has a CT coronary calcium score over 400, which would be considered high risk, or a CT coronary calcium score of 1,000, which is very high risk, that risk is going to change no matter what lifestyle supplements or medications you put on the person. That calcium score test isn't going to help you if you repeat it. That person's high risk, treat them as such. Now, there is somewhat of a gray zone if your score is 1 and your score is less than 400, should you be repeating that test? And some people, I will repeat it in 12 to 24 months. Other people, if it's elevated, it's not going to necessarily change my management in certain people, and then I'll tend to follow a non-invasive test that looks at the carotid artery called a carotid intermedial thickness scan. Also non-invasive, looks at soft plaque and will typically change faster, so the artery will be getting healthier, the thickness of the artery improves. If there's plaque present, you'll see it shrinking down, and if the plaque shrinks down here, it's likely changing in the heart as well. It is a little bit of a controversy, do you want your calcium score test to go down? Potentially not. Calcifications tend to mean that the artery plaque is stable. It's the soft, vulnerable plaques that you're more concerned about. The soft, vulnerable plaques are like pimples on the artery. If those pimples get inflamed and pop, they spill out this damaged cholesterol, these inflammatory markers, and then a blood clot forms, and the blood clot is what actually causes the heart attack. So, so some of the treatments, including statins, typically will take that soft vulnerable plaque and make it a hard calcified plaque. So most commonly, if you repeat a CT coronary calcium score test on somebody who's been treated with a statin, you'll see their score going up. And people will somewhat misinterpret that as that the risk is getting worse, but the plaque is going from soft vulnerable to hard calcified and not likely to have an event then. There's a newer test come on the market that I've had one patient do so far. Very interesting looking at the plaque characteristics. It tells you if the plaque is necrotic or if it's calcified. Necrotic plaque is the stuff that's scary. That's the stuff that's more likely to pop and cause a heart attack. Test not ready for prime time, not ready for asymptomatic people who are just wanting screening. This is more for higher risk people. So once I have a little bit more information about that, especially if I can get it launched in St. Louis in the near future, I'll be doing a talk about that. But great question. Well, welcome to Bradley from Solbasum. So we're going to be chatting about some red light topics in the near future. I'll talk to Bradley and try to set him up for a Monday night, depending on his time zone. He's usually in Australia, so we'll pick a heart health topic and red light. So, okay. Well, good evening, Dr. Paulvin. Thank you for joining. Another mitochondriac and expert on photobiomodulation. All right. Well, do we have any live questions coming in other than the calcium score? All right. Well, we're waiting for the questions to come in. I'll be coming back next Monday, 6 p.m. Central Time. Let's see. I don't think I have the topic picked just yet, but I'm going to be at the end of the month doing a red light topic with another photobiomodulation expert, and I'll also get Bradley on probably a week or two after that, and we'll chat about a cool topic. Photobiomodulation is fascinating, and I've talked to Bradley about it. We're basically, I don't even know if we're in the first inning for how red light therapy is going to change people's health. So if you see me in the office, I always have a light on, and I'll be teaching people more about this as we go forward. All right, so a little personal stuff. So some new blue blocking glasses, trying them out. Fit pretty decent. The lens quality is better than the original version, so I like it so far. We'll see if I'll keep using this as my day pair. This is probably definitely going after this. Just want to see what it looked like today. All right, well, no other questions coming in, no worries. Thank you guys for joining. I'm Dr. Michael Twyman, biohacking cardiologist. Heart attack and stroke prevention is what I love to do for people. If you're interested in working with me, I'm in St. Louis, Missouri, doing consults in the office or in telemedicine. Just drop me a direct message through Instagram or come to my website, drtwyman.com, spelled drtwyman.com. Have links to my prior videos, the products I recommend, and also have different videos of prior talks I've done. So thank you very much, guys, and I'll see you next week.